We are back on Morning Line. Our guest with us this morning is Dr. Gill Wright, Chief Medical Director for Metro Health, talking a broad range of things from the flu vaccine to COVID. You can get both of them together. The flu vaccine, it's evolved over the years, right? It does. And we've talked about how you have to get a different flu vaccine every year. Right. It's up there if you choose to do so. Is that where we think COVID vaccines will go down the road? It'll be something like every year, if it continues to change, like the flu, you'll have to get a booster.
That's a good possibility. They are looking at new pieces or the same pieces from the virus, because they've developed the vaccine identifies the spike protein. So it attacks the spike protein, which is what attaches the virus into your cells, and that's how it responds and fights it. But they're identifying new spots that may cause longer-term immunity, and so, but right now it looks like we'll probably, for the time being, need to have some sort of routine booster, but there's a possibility that we could get longer. And again, also down the road.
This booster came out now, of course, Omicron, a little more contagious, maybe not as deadly as some of the past strains. But is the thinking, though, that just like with the flu, with COVID, as we enter into the fall and winter months, we are going to see a spike? Is that a given?
You know, we don't really understand, because we've seen some of our spikes in the middle of summer. Yeah. So it is hard to tell, but anytime we put people inside, close together, anything that's spread by particles that we emit when we're talking, singing, any of those types of things, we're more likely to spread. So it's a good possibility that we'll see higher levels down the road in the winter months. But for some reason, we have seen spikes in the summer with COVID. So it may not follow quite the same pattern.
Yeah, sure. As far as, getting something ahead of time, maybe when you know you've been exposed, to prevent it. Talk a bit about Tamiflu, and talk about some of the treatments out there now for COVID early on that can lessen the symptoms once you have it.
Right, so in both cases, these are viruses, both the influenza and COVID, and there are antiretrovirals that work when you've been exposed. You know you're exposed, you may be starting to have early symptoms. There are these medicines that stop the replication of the virus and help you get control of it naturally and fight it off. And so in both cases, either with the flu, Tamiflu is the one we use.
How quickly do you have to take that from? Is it when you start feeling symptoms, or you realize that your wife or husband had it and you slept next to him last night, and all of a sudden you realize, well, I probably was exposed? When should you start taking Tamiflu?
Traditionally, it's always when you start to have symptoms.
Very first, early on, though.
Early,
once
first
it's
2 days.
It's not going to do too much for you.
Yeah, the longer you wait, the less it'll work.
Okay.
Because there's more and more viral particles there to work with.
So what about with COVID? What are some of the treatments folks are getting early on in the case?
So again, there's several antiretrovirals that can be used. Paxlovid's one of the names that can be used early and especially for those that have high risk, so have underlying immune problems or a lot of medical problems. They should definitely see their physician, their provider, early and get on medicine if they think that they're at high risk. There are some medicines that can be used for COVID that are able to be used in the hospital after they've gotten severe. So that is also a possibility to treat further down the road. But the one that's preventative or early prevention is within the first ideally 3 days.
2 or 3 days. Yeah. The earlier you can get to it, the better on that.
Yes.
So if you feel a little achy, you take that test, it comes back positive. The ones for COVID, something you have to get from, because you can buy a Tamiflu over the counter, right?
I don't believe so.
Okay, so that's prescription also.
Both.
So both of them you still have to go. Okay, I've not used Tamiflu. Knock on wood, I haven't had the flu in a while, but okay, that's good to know. We were talking during the break about, I forget when they stopped doing it, but I have if you rub my arm right here, you can feel a little scar, and it's a tiny little scar from a vaccination I got when I was born for smallpox.
Yes.
And I was asking him about smallpox. He and I both had it. Depending, what age did they stop, or how long ago did they stop giving smallpox vaccines? Since smallpox is, I guess, for the most part, been eradicated.
Yeah,
correct?
it's been eradicated. It's been, I don't remember the exact time, but probably the 90s.
90s.
Late 80s, 90s.
Like, for instance, my son didn't get a smallpox, and he's 20, you know, and so, but a lot of us did, and thank goodness for it, because smallpox is a horrible, horrible illness.
Yes.
But it's been eradicated. So does the smallpox vaccine, would it still, the vaccine that I got as a child, still protect me if I were exposed to smallpox now, you think?
It would to some degree. I mean, obviously, if we had
I have smallpox antibodies in me.
Right.
Cool.
Yes. And with all of the vaccines, you get memory cells that remember that exposure and can activate if you're exposed.
Oh, okay, but we need boosters in some cases. I've never had a smallpox booster,
right.
But
no.
Some stick around. So does that smallpox, vaccine that I have that's no longer given, and for good reason, you don't need to, can that protect me or you, since you have it, from anything else that's out there right now?
Well, it may provide a little bit of protection for monkeypox, but even if new smallpox showed up, we would probably boost everybody.
Boost again, if that came
and with the monkeypox, if you have not had a smallpox within the last 2 years, you should get vaccinated for it.
For monkeypox.
For monkeypox, which is the smallpox vaccine, actually.
Is it?
Yeah.
So the smallpox vaccine that I got as a child is the same thing they're giving now to try.
Well, it's probably different.
Maybe it's evolved a bit, because that was a long time ago. But all right, I'm glad. Let's go there then. Monkeypox is the latest in the pipeline, I suppose, and talk about who gets access to those vaccines today, and what you've seen in Metro. How's monkeypox cases?
Well, the monkeypox cases here as well across the country, we saw a fairly sudden rise, and over the last 2 weeks or to 3 weeks, that's dropped off significantly. We now have less than half of what the cases were at the top. It's a very small group that tends to have an issue with it, and it's men who have sex with men, or frequent partners, family members that have somebody with them. You have to be exposed to the actual pox virus.
How was that exposure? Meaning it has to be touched?
In the scab, or
so it's not airborne like Omicron.
It also can be airborne in close contact for a period of time.
But it's not as contagious as Omicron.
Oh no, it's not as contagious as most viruses. Yeah.
But all right, so who qualifies, like for instance, I would not be able to gain access to a monkeypox vaccine right now if I wanted it, because I guess I don't fit that category.
Right. So obviously, the categories we look at is men who have sex with men, people that have frequent, multiple sexual partners that may have risk, family members that are living in the household with somebody that's actively infected. Okay. So those are the main groups that were. But
not necessarily going to those who are immunocompromised or something along those lines if they're not in any of the.
The one exception to that would be those that have HIV.
HIV would.
Right.
Okay.
So those people living with HIV are also on the list of who can get the vaccine.
You know what's amazing is that, you and I and a lot of us have lived through various types of health, crises, and I still remember AIDS in the early 80s, and the fear of that, and HIV, and the treatments for it, and it's now, while you sure as heck don't want to get it, it used to be, in a lot of cases, certainly a death sentence, and now in the Metro, with the proper treatments and stuff, it's a chronic illness, isn't it?
Yes.
You can live a full life. Look no further than Magic Johnson of the Los Angeles Lakers, okay? I mean, but you can live a full life now, having HIV or AIDS. Maybe it's not full-blown AIDS, it's HIV. But there are side effects, and it's nasty. Anyone who says, oh, they've got a cure for it, I don't have to worry about it, that's foolish. You don't want it.
No, you don't want it. You have to take medicine for your life.
Side effects with all those medicines.
Side effects potentially of the medicines. So and it's a burden that you have to kind of remember, just like having diabetes. You have to remember you have it. You have to remember that you've got to take care of yourself in regards to that. You have to be careful from the standpoint of who your sexual partners are. Now, we do have PrEP, which is prophylaxis pre-treatment for those that are in a relationship.
Sure.
And so that has helped too reduce and really trying to eliminate new cases of HIV.
Yeah. As far as new cases, I'm curious. We haven't done a story on that. There's been so much more at the forefront. Are there a lot surfacing? Is it kind of plateaued in Davidson County?
Right.
How is it now?
I haven't looked at the numbers for a while, but I would say that it's plateaued, kind of just.
So is there, but it's not going up?
No, there's still pockets, but overall numbers are plateaued.
Yeah. It seems like with all of these, it's the new ones that come that, you have to react to it and we have to learn how to treat it. But in almost all these cases, from HIV to COVID to the flu and everything, if you take the proper steps, the real health dangers can be prevented across the board. I mean, if you do the right thing, you're going to protect yourself.
Yeah, for the most part, yes. I mean, there's obviously, I never say never in medicine. There's always some exception, but yeah, if you do the right things, you significantly reduce your risk of any of those diseases.
Save your life. Listen, we'll take a break. We'll come back. Our final segment with our guest. Among other things, I want to ask him about shingles vaccines. There's vaccines out there for different things. You don't want shingles, and I'm thinking about getting one, so I'm going to see what he says. We'll be right back with more right after this.